Good morning, everyone. Welcome to today's seminar on mobile young people. We have titled our seminar "On the Move" and "Where Does Wellbeing Fit?" I think we're really, pleased to have such a seminar during this particular time in South Africa and in the world generally, where we see a lot of mobility occurring. We see that there's an increase in young people moving to wherever places, whether through migration, whether through displacement, or, young people looking for economic opportunities. There's a lot of young people moving. But while there's this movement, we also want to say that there's a lot happening there, right? Mobility brings opportunities, but we also know that mobility brings different challenges, especially when we talk about access to essential services like healthcare, and more specifically, services related to sexual and reproductive health and rights. Now, mobile young people, whether they're refugees, migrants, internally displaced people, nomadic populations, they often face a lot of systemic barriers. We also know that they face a lot of legal restrictions, language and cultural differences, lack of documentation, or even stigma. And these barriers, we also know that they compromise their physical health, but also their mental well-being, their dignity, and the ability for them to make informed decisions about their body as well as their futures. Today, I think what we want to really do in this discussion is to better understand, the issues of well-being of young people on the move and how we can ensure equitable access to different services, different health services, and also a way, to promote inclusive sexual and reproductive health rights policies and programs that ensure that we leave no one behind. We're joined by different panelists today who will share their experiences as well as the challenges in the context in which they work in, and also strategies that they have come up with in the different work that they do. We want to invite everyone today to engage actively and ask questions and also share insights and reflect on their own work wherever they're doing this particular work of interest that can contribute to more inclusive and responsive health systems for young people. I think we will begin this really critical discussion by inviting Dr. Glynis Clacherty, who is a researcher at the ACMS, but also an independent consultant working with mobile young people on different issues. Welcome, Glynis. She is going to be our first speaker as we talk to our different experts for the day. Thank you so much.
Thank you very much, Lango, and thank you for inviting me to speak about this, I think, really important topic. What I'd like to do is I want to use some of the research that I've done with a colleague, Rebecca Walker, at ACMS. And I think that if we're going to talk about sexual and reproductive health programs, any kind of program actually, it's really important for us to understand what is the reality of the young people that we're talking about. And so I've entitled this "Begin With Us and Our Worlds," and I've tried to link some of the research findings to and given sort of pointers about, well, what does this mean if we're going to be developing a program, or if we're going to be looking critically at the existing programs programs that we have. So we're starting with the young people's perspectives. Okay, sorry. So just, this is a collection of findings from 2 pieces of research that Becky, who's also a researcher at ACMS, did together. The one is a qualitative study done in 2020 with Girls on the Move in Johannesburg inner city and Ivory Park. Inner city was young people from a number of different places, Zambia, DRC, Malawi, and Ivory Park was young women, almost all from Mozambique. Then we did an ethnographic study in 2022 with young people on the move in 2 border towns in Zambia, which were Katete and Chipata, which are right on the border of Malawi, but also close to the border of Zimbabwe and Mozambique. So it's a typical border town situation. And we felt that that was an under-researched area. We don't really know a lot about young people in border towns. And then I've used a little bit of quotes, a few quotes from some unpublished research, which is was based in Cape Town, which we'll do a webinar at some point about that. Just to say that both of these studies used a participatory methodology. So there were activities and discussions to really understand below the surface. So they took time, they used a particular methodology that has activities that allow young people to unpack and to go deeper into their lives. For example, a book that goes page by page. Or a map. The ethnographic study used a map of places that you go to. The work in Zambia. So I just wanted to say that it's really important that we don't see young migrants as a kind of homogenous group. And that's the first thing we need to keep in mind, I think, when we're looking at what kind of programming or even research that we're going to do. And young migrants, they're not all the same. Their lives, needs, and strengths are different. And that's something we found in both of these pieces of work and a whole lot of other work that we've done. And age, obviously, you know, much younger age the differences are related to age. They're related to personal characteristics. You know, some young people and the research that looks at resilience shows that some young people have internal characteristics which are often built on or broken down by family structures. So their country of origin makes a difference. Young people in DRC, for example, have a very different political environment and traditional norms and values that are part of the society that they come from. And then home and family experience at home in the past, their childhoods. So the young people, for example, in the work that we've done in Cape Town, their childhoods were fractured. And that's had a huge difference on the way that they see the world and the way they live now. The journeys that they made, how did they get to South Africa? And some in a simple way, some in a much more traumatic way. The reason for leaving, is it conflict like it is in DRC, for example? Is it work, which is largely the motivation behind young people choosing to come to South Africa from Mozambique? Is it education? That was one of the motivators that we found in the border towns. Young people from Malawi were actually crossing because there was a better education in Zambia. Obviously, traumatic experiences, what they've experienced in the past affects their well-being. Their present social networks, are they alone? Do they have siblings? Do they have caregivers? Do they have friends? And some of them, do they have partners? So that affects the way that they interact with the world and the way they understand the world. the locality of the settlement in their destination country. For example, we found huge differences between those who live in the inner city and those who live in Ivory Park or on the border towns, which are sort of chaotic places with people coming and going and very different. So the other thing is the social norms in their country of origin and the local social norms, which are really important, I think, when you're looking at sexual and reproductive health and well-being within that. So this is just what young migrants have told us about their lives. So the first thing that comes up every time, and I think you know about it, and this applies not only to South Africa, but to the work in Zambia as well. And because Zambia, the young people in Zambia also there's a similar documentation regime where they would be arrested if they didn't have the correct papers. So this is just actually one of the young women speaking from the Cape Town research, and I just thought it summed it up so well. I go to a place to apply for a job. Hi, this is my CV. I'm ready to work. And the next thing they tell you, where's your paper? At the clinic, you just say, I'm injured. Can you help me? Where's your paper? You go to the police. I want to lay a complaint about someone who touched me. Someone wanted to rape me. Where is your paper? So documentation is absolutely key. It determines study, work opportunities, access to health services, as you see in that quote, everyday life, psychosocial well-being, and then the potential of detention, very much so in the Zambia research. And that's despite protective policies, particularly in South Africa, to ensure access to healthcare. This is the experience. I think I've put the recommendations for programming into this purple. So I think one of the really important things is to acknowledge the stress that young migrants live under. It's pervasive. And then the other response, I think, is the importance of advocacy, particularly for those who are working with young people directly. And that's to share voices and case studies. A lot of the advocacy I think doesn't include the reality of the young people we're talking to. And I think advocacy, in my experience with some of the important advocacy that I've been involved in at national and international level, is that it needs to speak to the head and the heart. And even politicians can be reached in the heart. And that's where the case studies come in. So those of us who are working on programming, it's really important to collect those stories and to share them with those agencies that are doing advocacy. So documentation is the first reality. And obviously documentation leads to fear. And fear is a dominant theme in much of the work, but particularly in these two pieces of work. So they're not able to access services because they fear that if they went to the facility, they'll be identified because of their language as Malawians, and then the immigration will arrest them. Some others die of diseases like malaria. So that's an NGO worker in Chipata in Zambia on the border town. So I think that fear is a really important aspect of their lives that we need to acknowledge in any program that we develop. And I think that the way we acknowledge that fear is through empathy, through respect. So respect includes acknowledging that these young people are not just victims. We need to respect them for and I'll talk about that just now, for the strength that they have and the ability that they have, the choice that they've made to come across a border and to sometimes in the border towns make a long journey from Mozambique, for example, by walking. So respect, humility, and time are important. And I just wanted to reference, though it's related to child protection, a resource that I think is really useful for even outside child protection. And it talks about the importance of empathy, respect, and humility. And it actually unpacks those concepts and gives you ideas about ways that you can represent those characteristics. It would be really useful for training. So that's how one of the ways I think we respond to fear. And of course, fear relates to invisibility. And that's one of our biggest challenges, I think, in any program that we do. So James Clacherty, who's my son and an anthropologist, worked with me with Becky and I on the border stories. He actually did the field work. And he was, for 2 weeks, he talked to NGOs who were working with migrants that were being funded by projects, but they didn't really know them. And I was worried I would not be able to do the research. They were hidden, and they did not want to identify as migrants. It took a long time for him to find where they were. And that was similar in the Mozambicans that we came across. We actually, eventually, Claudia, who was doing the research, said, I don't know, they're in the markets, but they won't say they're Mozambican. And in the border towns, they live in these compounds, which are just a local word for an informal settlement, because they're hidden in that kind of informal environment. And then the final one, I think, which is a young pregnant woman living in Ivory Park, I'm afraid of arrest, even young women. So I stay in the house and I don't go out. And what does that mean for us in terms of sexual reproductive health programming? How do we reach young people like this to promote their well-being? I think go where they are, which takes time, and finding where they are. And then there's this really useful concept which is looking at rapid ethnography, which is quite widely written about. But I think a rapid ethnography is basically going into an environment and looking and finding and talking and just spending time. And that's how you slowly, and that's what James and what Claudia began to do, and to look at who are the leaders, where are the churches, basically doing an ethnography. And the Vessels book, I'll speak a little bit more about that. The other one is looking for places of safety. That's how we found the young people in Ivory Park. So we actually ended up finding them in hair salons. Marlena here, she knows us, she's from Maputo, she advises us. So we found that the young women in Ivory Park gravitated towards the Mozambican woman who ran mostly with the people who are older women. One of the things we found in that work is that many young migrants are mothers. And again, this is about, not assuming that they are a homogenous group, that they're young people. Many of them are, in fact, mothers. And if you look at the second quote there, the researcher says, and if you go to the clinic, we don't go. What if your child is sick? God is always protective. So there's kind of this powerlessness about, which is really worrying, I think. So I think it's really important to have programming that's sensitive to young mothers. They live in a legal and fear liminal world because they're afraid and they're invisible. We need to go and find them. And that's where I think the work that Margaret's going to talk about is really helpful. I don't want to go over time. So I think it's really important to acknowledge that young migrant people are not victims. They know how to skillfully navigate their social worlds. And invisibility actually is an important strategy that they use. They have this lovely, all of the young people that I've worked with in various places, and particularly in these two studies, they support each other. That's an incredibly important strategy for them. One of the young people said the important thing is to find a circle. That's how you survive. They have sophisticated strategies for dodging the police, which we saw very much in the border towns. They learn local languages. They move about with locals. That's what they did in the border. One of the young people in the Cape Town research said, dress like them, act like them, speak like them. So you fit in. Young women seek out sympathetic clinics. The young women in Mozambique knew that the local clinic in Ivory Park, the health service staff weren't very friendly, but they knew that in, I think it was Rabi Ridge, there was the sisters, the nurses there were really nice. So they used to go further because that's a strategy. And seeking out safe places. Marlena, she knows us as she's from Maputo, so I think it's really important to work from these strengths. So even, for example, the safe spaces, and there are examples where in Sierra Leone, they've used the landladies who are sometimes the exploiters or the employers in a program in Rossano Garcia, who are sometimes the exploiters. They've actually brought them into the programming and they've become the people who make sure young people are safe. I just wanted to briefly talk about the psychosocial impact. I think this is led, so little 10-year-old, I have a problem of going to sleep because of no paper. She couldn't access education. If you had documents, then you are a person. Before that, you are invisible. So it's the impact of documentation and how important it is to make, when we do interact with young people, that we make them feel visible, that they are human beings. And I think this is taken actually from the research that I did in Cape Town, but I think it's so telling. I do not feel I belong anywhere. I do not belong here, South Africa. I'm not from here. I am nowhere. I'm not from this country. This young person came to South Africa when she was very young, and I'm not from this planet. I just feel like I do not belong here. So it's this feeling of not even being a human being, which is an incredibly, it's a crisis within inside that child. And it's really important that we acknowledge that. Just something very quickly. I think it's really important when we do psychosocial programming, we often just teach young people life skills, and we call that psychosocial. But it's not, it needs to be combined, with things like stress relief strategies, a safe place to just be, fun, to be nurtured, to build agency by making something, and child and baby friendly. And I think the reference that I've given here, the work that Becky and I did in a shelter, I think is a perfect example. And the Rossano Garcia is another, the shelter or the center run by the sisters at that place. So that's what I thought was really important. And thank you very much. And I have those references on a separate slide if you want them. Thank you. Oh, just to say a final word. This should be the foundation of anything we do with young people, because we need to build on what they say, rather than what we think is right. So it needs to not be agency initiated or agency led, but children and young people led. They need to lead us. And obviously that's the role of research for those people who are researchers, is to understand more. And there's a lot more to understand about their lives. Thank you very much.
Thank you so much, Glynis, for that. And I think you're right. Migrant voices or young people should be the beginning of where we actually think about what sort of solutions we can come up together with them to help them, maneuver these spaces. Our next speaker is going to be Mwelwa Phiri. She's from Zambart. She's a researcher at Zambart in Zambia. Welcome, Mwelwa, and thank you for being here.
Right. Thank you so much, Langa. And thanks everybody for coming. I'm just going to stop my video because I know it might just interrupt my internet. So I will be speaking a little bit about some of the research that we've done at Zambart and how it's included mobile populations. And I'll look at it from a different gender. with some focus on young men in particular, and I'll explain why the focus has been a bit on young men. Okay. Alrighty. Okay. So just to say, Zambart is a non-governmental organization. We're based in Zambia, Lusaka, and we do public health research, primarily in HIV and TB, but also in SRH more recently, and among young people and men, which is what I primarily do research on. And so I'll just give some background research that we've conducted and how we've conducted it and how I think we sort of tried to fit in well-being, but also what we've learned and how we've tried to include that in upcoming research, which includes the nurture for youth. And I won't go into too much detail. I think it's already been spoken about. So for me, my journey with mobile populations among young people, but also other populations such as men, really started from the HPTN study. So the HPTN 071 was the largest universal test and treat trial conducted. It was conducted in Zambia and South Africa, in several towns or communities, and it was provision of door-to-door services, which included HIV testing, condom provision, PMTCT prevention, STI screening, and a whole lot. And I think our approach in the HPTN was universal. And so it was a deliberate approach so that we didn't leave anybody behind. And one of the things I think we're quite deliberate about is any research that we conduct, any interventions that we conduct are inclusive, and we don't require documentation, I think, as Glynis has said, which is a huge barrier. And that's something we've deliberately done, that we don't include need for any specific documentation in anything that we conduct. And the HPTN 071 was actually very successful in attaining the first 90 in urban mobile populations, so male and female. But I think we realized early on that there were testing gaps. So this is HIV testing. And the testing gaps remained in men, but also young adults and most mobile individuals. And these mobile individuals were young adults particularly, and young men specifically. But they were young women as well. But it was mostly young men that were the most mobile individuals. And some of the qualitative work that was actually conducted in some of the pop art intervention sites did reveal that for Zambia, for example, trading drives quite a bit of that mobility. And we had different, so we didn't, because of the way the communities were located, there was in mobility within the community, so or within the city where the community was located, so people would leave their homes or the community to go and work elsewhere. But also including migrants coming into the community. And it was largely driven, this mobility was largely driven by livelihood factors. So people aged 18 to 45 were on the move a lot. Charcoal trading, fish traders, cross-border traders were the people that we found in these communities to be quite mobile. And so the mobility of people, particularly the young men, as I mentioned, emerged as a key barrier, which was primarily driven by looking for work. And so one of the things that we did as we became more aware of this gap is that we implemented an HIV self-testing intervention to try and reach more people with HIV testing. And some of the findings were that the HIV self-testing was actually acceptable for busy and mobile people and those who were formally employed. And some of what was mentioned was that they felt empowered in knowing how to test by themselves, but they could do it in a convenient manner, and it was in a confidential manner. So the HIV self-testing study really had some good policy implications in that it emerged as a potential solution to reach the hard-to-reach groups, which were mobile sex workers and working men. But obviously, as we were doing this, I think the language around hard-to-reach groups was also changing, and the realization that it's not the groups that are hard to reach, but the services that are hard to reach for the mobile people, the working men, the people that we had gaps in. But it definitely added to help overcome barriers, for example, for privacy, but also men not found at home, but also for people who were mobile or who didn't want to be known at the health facility. So the self-testing was a way to reach that population. And so we also then tried, we still had gaps, obviously. And so we then tried campaigns which were targeted towards young men or men in general, called Man Up campaign. And I see Steve is here, who was quite instrumental in this. And this was a campaign style sort of provision of services in the pop-up communities, which were trying to reach people, again, the mobile populations that we couldn't reach from the households. And again, it showed variable success, because while people did come, we still missed quite a big chunk of men that we needed to find, which was the young men. And so after the pop-up intervention ended, we sort of put up hubs in the pop-up communities. And the idea behind these hubs was to try and catch the mobile populations who were moving in and out of the community, either mostly actually targeting those that were working outside the community. And so we set up these hubs which provided services similar to what was provided in the door-to-door in places which were high movement areas, for example. So markets, for example, where we knew that a lot of people would be, or a lot of the mobile populations would be, markets, bus stations. And that's where we set up these hubs in order to try and essentially close the gap in reaching these populations. And we found that accessing these services appeared to be acceptable and appealing to young men who preferred accessing them at these places as opposed to home. And so the men that accessed were generally younger than those that were reached at home. So we're making some little incremental progress as we went along. And so what emerged from this is the co-design and co-development of an intervention for young people called Yatu Yatu, for us by us. So this was a cluster randomized trial of community-based sexual and reproductive health and HIV services for adolescents and young people 15 to 24 in Zambia. This was conducted in 2 communities in Zambia, Chipata and Kanyama. And Kanyama historically has a large mobile population, which includes migrants, but also Chipata as well. But as I said, because we deliberately try to be inclusive in everything that we design. This was a co-designed intervention, by the way. And in our effort to be inclusive, we don't ask for documentation, for example. And so this is just a schematic of what the intervention really was. It was spaces that were providing SRH away from the health facility, and all that people needed to access the services was a Yatu Yatu card, which we had provided beforehand. We had done a sweep through the community, and everybody that was eligible who consented then was given this card, and they could access these services. And that card incentivized accessing services at these hubs. And this was essentially successful in terms of our main outcomes. So in terms of coverage, for example, we had an impact across all the different age categories, but among young men, not as big an impact compared to the others. And when we look at the primary outcome, which was self-reported knowledge of HIV status, we had a very significant impact among adolescent boys 15 to 19, but again, not as big an impact among the young men the young men aged 20 to 24. So still some gaps remaining, but we believe that it was this success was actually driven, one, by the co-design process that we conducted, which Melvin, actually, who's also in the call, was very heavily involved in. And this was largely driven by HIV testing services. Just to say that the hubs had been designed to also include other services, so life skills, for example, and CSC as well was provided at these spaces. This was in an effort to provide a holistic intervention for young people, which we hoped would improve their well-being as well. So from this, again, there were still some gaps. We were still not quite reaching the people that were not reached. Again, this was the young men. And so this kind of has narrowed my focus personally in terms of research. And that then brought about the Yabagai Che study. So the Yabagai Che study was, this was a formative study, started off as a formative study, and it included crowdsourcing. So hearing from the community on how we could actually get men to test for HIV, particularly young men. Again, Steve, who's in the picture there, was quite instrumental here. And we aimed to design an intervention that captured the mobile young men, or the men that we basically could not find at home and that we were missing with the hubs. How by designing this intervention with them, how could we get everybody that we were missing from household surveys, that we were missing from the hubs, particularly among the young men? And so what has happened is we did co-design this intervention, and we've actually received funding to implement this, and in a 5-year study, and we hope we'll have results in about 4 years or so. But just to point out that part of this study was piloting something called time location sampling survey, because these young men are mobile, and we have to find a way to measure whether what we're going to do has an impact among them. And they're still going to be mobile. And so if we still do a household survey, we're not going to be able to measure whether we have an impact and we're reaching them or not. And so this is where the time location sampling survey comes in, and that we piloted and was successful. And we'll actually then be scaling up and see whether it can be scaled up and it can truly measure an impact among mobile populations. And another key study that we're going to be working on going forward is called HIM, which is Health Innovations to Reach Mobile Men with Comorbidities in Uganda and Zambia. So this study is very special because it's really targeting mobile men only. And it's targeting men in specific border towns, but also including one of the communities in Zambia as well. And the idea is to co-design a mobility-sensitive intervention to improve access to non-communicable disease and infectious disease screening and care. But what's really interesting about this is it's a transdisciplinary research. And so we want to triangulate ethnographic, epidemiological, and health services data. And one of the major outcomes is to have health strategies which are mobility sensitive. And I think this is also what sort of Nurture for Youth is aiming for, but particularly for young people, which includes male and female young people with SRH services. And so I think in conclusion, co-designing and basically hearing the voices of the mobile population that we're targeting is going to bridge the gap in us fitting well-being into anything that we do. And it will allow us to explore comorbidities, which include mental health. But more importantly, we think it will allow us for what is well-being to be defined by that mobile population, because obviously there are subgroups in mobile populations, and those subgroups will have very specific ideas of what well-being means to them. And so co-designing any interventions with them, we think, can lead to sustainable practices. And so that's how we'll get to universal access to care. And yeah, that's what I had to share. Thank you very much.
Thank you so much. Thank you so much, Mwelwa, for that presentation, which was really comprehensive. And, it's so interesting how you are doing work in Zambia, and Glynis was talking about working in a different setting as well. But the issues that are being echoed are really similar. And also the acknowledgement really of, different contexts, needing different things, but the issue really of co-designing. And Glynis really spoke about how we need to speak to young people to understand their needs. And this is the same that you're echoing. Now, I think we are going to call upon our final speaker of our seminar, who is Margaret Zulu, and she is a program manager at Save the Children, and also dealing with these different issues around mobile young people. Margaret, over to you. And thank you really for being here today.
Thank you very much, Langa, and good morning to everyone. As she indicates, I'm Margaret Zulu from Save the Children South Africa. I am responsible for child protection, including migration and displacement. You see there my email address if you need to get hold of us. But I would start by just indicating who we are as Save the Children South Africa. As you know, we are a child rights organization. We exist to make sure that every child is reached, and so our primary focus is children, and secondarily we also focus on young people. We are dedicated to protecting and advancing children's rights. We operate from Pretoria, South Africa. However, we are in 5 provinces in South Africa. We are joined to the global the Global Save the Children International. However, we are a locally based organization registered in South Africa. And so we have comprehensive programs around protection, migration, and displacement. We also focus on health, child rights governance, and also we ensure that in all this work, we involve children and young people who are the key stakeholders, and we work very closely with the government as stakeholders. It's important for me to really indicate that for young people, you will see here on my slide that we need to ensure that they have the capacity on sexual and reproductive health and rights, and they have the capacity to also participate in all decisions that affect them. And this includes all children and all young people, including migrants and displaced young persons and children. And so for the purposes of this conversation, I am going to switch off my video, and I'm going to show a video of some of the work that we've done as a start, then later on give a brief overview of some of the achievements and some of the challenges that we still face to young migrant persons. Apologies, looks like now I have a technical glitch.
My name is Tandega. I am 20. My name is Tandega. I am 23 years old. I am originally from Mozambique. My parents are from Mozambique, but they came here in South Africa during the civil wars, and that's when they got South African documentation, and that's how I was also able to get the South African documentation. I was born. My name is Tandega. I am 23 years old. I am originally from Mozambique. My parents are from Mozambique, but they came here in South Africa during the civil wars, and that's when they got South African documentation, and that's how I was also able to get the South African documentation. I was born in South Africa. My upbringing was a little bit difficult because at that time here at home they were not working, so they were just living by harvesting vegetables like cassava, and all those sorts of green stuff. Then the food was bananas, mangoes. My happiest moment in my childhood was when we were full in the house playing, and it was all fun and sharing all the food that we had. Academically at school, I was excelling well because I've also received awards, a few awards. What I wanted to do after matric was doing law. I tried applying at universities, but they didn't accept me. They were not like I had a four-year gap year. I matriculated in 2019. After matric, there was nothing that I was doing. I was just here at home doing nothing. It was all of that. Being at home made me feel depressed. I don't want to lie, because I felt like I would be like other children, going to overseas and pursuing my dreams. My mom was helping me financially to get clothes with that little money that she was getting, because I was not able like to do all my needs that I needed. I couldn't buy like more things that I needed for myself. For example, like some toiletries. Yes, we had to share with my siblings. It was so sad. Sometimes like you had to borrow a deodorant from your sibling, and she would just shout at you and say, "Why don't you buy your things? Why you don't have the money to buy it?" I heard about Save the Children on Facebook. There was this other girl who posted about it, that Susan was looking for girls around here to participate in a certain training, and they were contact the same. That's where I got in contact with Susan, and she told me where to meet and how is it going to be. To be honest, I didn't have any hopes about the meeting. I just went there because I told myself that there's nothing that I'm doing at home, so why don't I go there and hear what they are saying? Maybe I'll get more information about it. We had several trainings. We had life skills training, reproductive training, and business planning training. The business one was my favorite training because I learned a lot about business, and in mind, I already had some business idea that I wanted to start, so like I was more interested in it. We were learning how to make a business plan and how to approach clients, how to manage your money, and how to calculate your profit. I don't think I was gonna have all the knowledge that I have now if I didn't attend the training that way at Save the Children. I do have a business now. My business right now is cooking food here at home, and I deliver it at school around my communities during break times. And I've also added some ice blocks in the business, and there are also fed cooks that we are doing in the morning with my mom. I really do enjoy what I'm doing now because I really love cooking, and here at home they are helping me, so they keep me in track and they encourage me to do more. It has changed my home situation financially, and I was able to assist where I can here at home because like no one is working right now currently. We are all depending on the grants, my grandmother's grant and the children's grant. Like on December, I was able to buy like food here at home. As this where I was seeing buy some groceries and all the stuff. So the children has helped me as a person to gain more confidence, to speak, to learn how to speak for myself and not bottle things up. And it also helped me how to live with others, how to treat others well. It has also helped me financially by assisting me with buying the equipment that I needed for the business, and I thank them very much for that. The equipment that Save the Children bought for me was a 4 burner stoves, a folding table, some cutlery, dishes, plating, dishes, some packaging, and also some clothes, washing clothes. My family feels really proud of me right now because sometimes they be like, "Hey, sister, I went I really feel grateful for Save the Children for giving me this opportunity, and I'm also grateful, and I also feel confident about myself. It does make me feel like I can do anything. Currently, this year I am studying business management. I am paying for my own studies with the money that I made last year from my profits. I was able to pay the registration fee for this first semester, and I am also paying my fees monthly, which are 650. In 2 years' time, I see my business catering for weddings, catering for funerals or big events and functions around here in Mpumalanga. And I know that I can do that because always I wake up with the mind that I can do more into it.
Thank you very much for watching. So what we see there is a story of resilience, a story of dreams, and we see, as indicated by previous speakers, that young persons on the move are resilient. They know what they want. They can participate actively in decisions that affect them. And now I'm going to refer to my slides. And so at Save the Children South Africa, we work with different categories of migrants. These categories include unaccompanied children and young persons. Some of them are separated. We also work with refugee children and young persons. We work with asylum seeker children and young persons. And we also have encountered children and young persons that have been trafficked, smuggled, and a lot of them are undocumented, meaning they do not have identity. And some of them are actually now stateless because they do not have documentation. And so under this program, we see that these categories that we work with have experienced a lot of invisibility. They highlight issues of lack of access to services. They highlight a number of issues that have also been shared by the previous speakers, and I won't dwell on that because of time. But I would like to quickly now refer to what does well-being mean for them. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease. But when we listen to the stories of young persons, including children who are migrants, this definition does not fit into their lived experiences. They see well-being as access. They see well-being as opportunities. They see well-being as integration and being accepted into their communities, their host communities. They see wellness as psychosocial well-being, emotional resilience, and also they see well-being as being visible and having documentation for them to be able to access their rights. They see well-being as being able to be seen as a person for who they are and not merely for where they come from. And so looking at their lived experiences based on the programs that we undertake at Save the Children South Africa, it's important for us to paint a picture of what happens to this young person as they move from the place that they are coming from. In this case, it could be Zimbabwe, it could be Lesotho, any other surrounding countries, or even further. We know that they experience chronic infectious diseases, they experience violence, including sexual violence. They do not have access to health, and they experience a lot of fear, as also indicated. They experience just being invisible, and we've heard of the Malaysia transport, where young persons from Zimbabwe, particularly girls who are moving from neighboring countries, being forced to pay using their bodies for them to be brought into South Africa. We've heard of terms such as swimming, where young persons, even children, swim through the river to avoid the police. And they get into South Africa and they walk for long distances, not even knowing where they are going. They experience hunger, insecurity, but then let's also reflect on what happens when they are now here in South Africa. We've heard what has been shared about Zambia. We've heard what has been shared, even the research here in South Africa, that they have barriers to accessing services. They do not have documentation. When we think about the critical basic issue of education, some of them are denied education. We have seen what's happening in the country around access to health, and how when you seem to be from other country or you are not presenting documentation, then you are not supposed to be in that public health sector. But what does this mean now for the work that we do and for the young persons that are coming from neighboring countries? So at Save the Children South Africa, we have a number of projects. At the moment, we have about 4 projects, one focusing on children involved in unsafe migration. Although our target is up to 18 children, but we're secondarily, we also focus on young persons up to 24 years of age. And we have the Girls on the Move which Glynis also alluded to. We have the Sexual Reproductive Health and Rights Knows No Borders, and the Violence-Free Childhood projects. I just want to quickly share with you what we are trying to do under these projects and what are the challenges that persist when it comes to the work that we are doing. And so generally, we want to see a strengthened and realized child rights environment in Southern Africa, mostly because South Africa is, a place of destination, preferred destination within the region. And so our focus is on strengthened legal policy frameworks and coordination mechanisms at both national and regional level for child protection systems to provide migrant and displaced children, including young persons, with protection services. We have also worked with duty bearers such as your Department of Social Development, Department of Home Affairs, the border management authorities, and other service providers to ensure that we are all have the same standards of practice with regards to working with young persons and children involved in unsafe migration. But we don't end at that. We also involve host communities. We involve the children themselves to participate in all this. And so the video that you watched is under the Girls on the Move project, but we have the HIV Knows No Borders project that focuses, this is in partnership with the International Organization for Migration. We focus on young and vulnerable persons aged between 10 and 29. Some of them are sex workers, they are migrants, but we also focus on their host communities. In so doing, our objective is to have an improved sexual reproductive health and HIV outcomes and quality of life among young vulnerable persons aged 10 to 29 years, including migrants and sex workers living in migration-affected communities in 6 countries. And so in South Africa, we are focusing mostly in Limpopo, around the border areas. We also focus in Mpumalanga. And so the objectives are around healthy choices for young people, access to services, which is really critical, and also creating an enabling environment for all of them. The girls are perhaps just reflecting on that. What we see is that mostly young persons do not want to identify as migrants because of fear of being taken by the police. We heard the phrase that Glynis used in her research, and this is a case story where every time they are asked, they go to the clinic, where is your paper? Where is your documentation? And that is also true for us as we implement the Girls on the Move project and the Knows No Borders project within South Africa. I just want to highlight for the Girls on the Move project that under this initiative, we also have Girls Decide sessions, which aim at empowering girls in situations of migration and displacement so that they are able to have safer journeys and also have better outcomes. And so our objectives, we ensure that we create safe spaces for these girls, and they make decisions on what is safe for them, what is it that they want to do. They address specific issues according to their needs, and most of the issues, as indicated previously, relate to sexual health and reproductive rights, access to services, and also mostly our girls are young mothers, And so we also include parenting support programs where we empower them with parenting skills. And so these girls decide sessions, we see that there are also some kind of network for peer-to-peer support. They are able
Sorry,
to...
Margaret.
Yes.
Sorry, Margaret. Your slides are not currently moving.
Oh, okay. They are moving on my side. Yeah. Apologies.
Okay. Is it possible for you to go to the presentation mode right at the bottom of your screen?
Let me stop sharing.
Yeah. Yes. Sorry about that.
No worries. I didn't anticipate these glitches. So at the bottom, on share.
Yeah.
And this is what I was currently sharing.
Okay. So we are seeing them, but then we don't. Oh, okay, perfect. And then if you go on the, oh, there we go. On the icon that looks like a glass, I guess, a wine glass, then you can put it on presentation mode at the bottom of your slides there. Then I think they will move.
Okay, that looks like a glass.
Yeah.
What do you see now?
At the bottom. So we're seeing the slide, but I'm thinking if you put it on presentation mode, it will be able to move. So at the bottom right, next to the minus there. Yes. So if you go to the right, you see where there is the minus. So move your cursor to the right.
Yes.
Right. Yeah. Move it right. Let's go. Right at the bottom. Don't move it up. Move it to the right. Keep moving it to the right. Next to the minus sign, you'll put it on presentation mode. And then I think your slides will be able to move.
Oh, apologies. On my side, I'm not.
Yes. You're not, you can't.
Yeah, it's not.
Okay, just try and move. Just try and move the slides. Let's see if they'll move now. No, they're not moving.
It has moved now on my side.
No, it's not moving. No, it's not moving. But that's fine. You can just continue with your presentation.
Okay. Apologies to everyone for that.
We will share the slides for people to reference.
Yes, absolutely. I will now end with some of the lessons that we've learned from all these projects. And one of them being a rights-based approach where we focus on access to basic services for all children and young persons, irrespective of their documentation status. And our legal instrument in South Africa really indicate, particularly for a child, because we need to start from there. We need to think about what are we building in these children? What will happen to them after 18? And so irrespective of whether they have documentation or not, they need to access the services as we work towards documentation pathways for migrant and displaced children. We have learned about coordination mechanisms, which we have at provincial levels and at cross-border levels, where cases of migrant children, migrant young persons are brought to the fore, and best interests of the child and the young persons are determined and durable solutions are found for them. We have a good model at community level of cultural mediation, and I think this has worked very well because, as indicated earlier, migrant persons are invisible, and at the same time, because of fear, they do not want to be identified as such. And so through our cultural mediation model, where we have community agents who are able to speak the language depending on where the person is coming from, they relate with them, hold sessions with them, they are able to find out what their needs are and refer them appropriately to the relevant services. And through that, we've been able to see that collaboration with relevant services such as your Department of Health, Department of Home Affairs, we are able to intervene and support in certain cases. But just to indicate that even after capacity strengthening for duty bearers, we still see irregularities in terms of how different duty bearers approach issues of migration. So there's no standardized ways of dealing with children and young persons. There's issues of discrimination. And so that's where we see that that still needs to be strengthened. Through our policy advocacy, we have been able to influence certain policies, including the recent protocol on the multi-sectoral management of unaccompanied and separated children, but also young persons. And so from there, what we are learning is, yes, there's concerns around national security. There's concerns around resources. We see that and we hear that. But is that the real issue? What is the real issue on the ground? What do we need to do together in collaboration to be able to address issues of statelessness, to be able to find durable solutions so that, yes, we do not make migration as something that is bad, but we think about the resilience of young people and what they actually bring to the table in terms of contributions to the economy and contributions to the communities that host them. I would like to end by just projecting some of the stories of change. And thank you so much, Dr. Langa, and thank you to everyone for listening.
So very much, Margaret, and to our other two panelists for such interesting insights on, I guess, also the work that we have as different stakeholders on this call, as researchers, practitioners, people working in different spaces on dealing with issues of mobility and young people. And I really like, your closing remarks on what can we do to work together to find real solutions of these really complex issues on mobility and young people. Now I'm going to open up the floor for people that have questions or sharings on the spaces that they work in relating to young people and mobility and well-being, or other issues that you think sort of are part of this conversation that we're having today. I think if anybody, you can raise your hand. So Stina's hand is up. So Stina, please go ahead. Thank you.
All right. Hi, Langa. It's not a question, but just a comment to say I really enjoyed Margaret's presentation. We just came back from the field in Messina, And most of the participants, they raised an issue of they refer to it as the undocumented generation, where migrant women have had children with South African men, but they didn't manage to get the IDs for the children. And they say that this is like a major concern in South Africa, where there is this generation of undocumented youths. And then the participant that I talked to, she also indicated that the dilemma that is there is that most of these children, they also don't want to be referred to as Zimbabweans. And she told me of a situation where one of the youths hit the mother with an axe because the mother wanted to take the child to Zimbabwe to get them Zimbabwean documentation because the father has long passed. And then they had concerns that if the father is there and is present, they need money for the DNA test. And then most of these people, they are living precarious lives where they cannot even afford to pay for the DNA test. So it was just interesting and a reminder from what I experienced in the field when Margaret mentioned about how Save the Children also helps like the work with undocumented youth. Thank you.
Thank you so much, Sostina, for that. Anybody else before I give it to the panel to sort of also comment relating to Sostina's comment on the presentations? Anybody with a comment, a sharing? Okay, Margaret, over to you. If you could also comment, I guess, on Sostina's comment on the work that you're doing.
Yes, thank you very much, Sostina, for your contribution. Indeed, one challenge we faced with young persons, even migrant children, is the issue of documentation and just the requirements, which are not always standard. But the issue of DNA does come up for children that are born from South African fathers and the mother is from another country. Most times, in most of the cases that we've dealt with, the mother would not have documentation, and also the father may be late, or they are not together, and that brings about issues for the child. And so what we are learning, it's not only the child, but as they grow, we have a number of young people, and we've referred these cases to our legal experts, Center for Child Law and Lawyers for Human Rights, that as they come out of care, as they accessing education, when they reach 18, what happens to them? They have no documentation, they have no future. Issue of DNA is really mostly not so useful in my view, because most of these parents cannot afford. And so we need a situation where there's a waiver, depending on each case, for testing for DNA. And even if we could come together to be able to support DNA testing for certain families, also be able to collaborate with the Department of Home Affairs. So really, we are looking at durable solutions that would ensure that the best interests of the child, the best interests of the young person is at the fore of all these decisions. Thank you, and over.
Okay, thank you, Margaret. Sorry to just come back again. You mentioned about the issue of the waivers, right? And then to just ask, like, what steps have been taken by, for example, organizations like yours, the civil society as well, to try maybe to engage with the policymakers when it comes maybe to waivers, or maybe reconsidering helping those children who are fathered by South African men who can't access that documentation, because I think, as you've mentioned, it also impacts their livelihood and also their career.
Through you, Chair, I will respond twofold. First, when we do refer these cases to the Department of Social Development, we also get a chance to have that not only family tracing, but conversations with the parties involved. And in certain cases, we find that then the father is able to assist with DNA, and they are able to get some money. But when it comes to waiver, we have not had a breakthrough with the Department of Home Affairs, because they insist that it's procedural, it's within the confines of the law. But our suggestion is that we need to look at each case as a unique case and find solutions that are specific to the needs of that particular child or young person. We have also been able to work with legal experts, like I mentioned, Center for Child Law, Lawyers for Human Rights, and that referral and coordinated way of working, we realize that it assists to get certain cases to be sorted. We just had a case in Limpopo that we referred to Lawyers for Human Rights. The child could not get an operation. In this case, it's a child. And we were able to get support to speak to the Department of Health, and also to then speak to the Department of Home Affairs about the unique case of this family of not being able to afford DNA. And we were able to get help. So there are cases where we do get help, we do get support, but I think the strengthening in this case would be coordinated interdepartmental work, and coordinated efforts even with non-governmental organizations and the academia, to not only bridge the issue of data, because what we see could just be the tip of the iceberg. There could be more, and we might just end up in the next 10 years with a lot of young persons who are undocumented. We would have double-based cases, and to avert that, we need to start now and decide on what we really want to do with these young persons. Some of them are stateless. Again, we are working collaboratively with legal partners to then address issues of statelessness. We have, for refugees as an example, and this is my last point, where when they have refugee status and the child then gets over 18, they are still linked to the legal status of their parents. And so that becomes a challenge. So we've suggested delinking as a way for the young person not to be stuck, because when they are still linked and maybe that documentation is no longer valid, then it becomes an issue for the young person. There are many legal complexities around the issues, but our ask as Save the Children South Africa is dialogue, is engagement, even of not only host communities, even our partners. I like to call them partners, our Dudula partners. We come to the table and speak about durable solutions and what we can do for everyone in this jurisdiction of South Africa.
Thank you so much for that, Margaret. I guess the last question was, how can researchers who meet such participants in the field engage with your organization, or can we refer them to your organization? This is Sostina. Sostina, I think you're referring this question particularly to Margaret. Am I right?
Yes. Okay.
That's a relevant question. because at the moment we are still undertaking further research. We do have anecdotal data, and that is why for us it's really important that we work with Wits University, different universities, to find solutions based on evidence, to engage with the key partners based on that evidence. However, there is still a need to bridge that data gap. And so in terms of referrals, I'm happy to share our contact details so that you are able to share with us even pieces of information that you have that would assist us to be able to reach those vulnerable young persons who are migrants that we have not yet reached. The work is enormous, but we do depend on your partnerships to be able to undertake this work, and also continuously find and mobilize resources to support the government, such as your Department of Home Affairs, in with capacity and seeing them as a key partner and not as a department that is doing wrong. Because yes, irregularities in migration is an issue. We are aware of that and we do acknowledge that, but we can prevent that, and we can do something about young persons who do not have documentation.
Thank you so much. I think we're over by 3 minutes. In a few seconds or a minute, I will ask each of our panelists to just say their closing remarks so that we are able to close our session for today. We will start with you, Glynis, and then Mwelwa, and then Margaret.
Thank you, Langa, and thank you to Margaret and Mwelwa. What's so exciting, I think, about the two presentations is the way that they link to the summary, I suppose, that I presented. So there are all sorts of interesting ways that the study in Zambia is looking at invisibility, for example. The fact that Save the Children is looking at mothers. The fact that there's work being done on safe spaces. And yeah, I just think it's very exciting that so much of what young people have told us in the research that we've done is starting to be implemented. I suppose the key thing now is to look at the impact and what we can learn about that, and also just the practical understandings that we've learned. And I think the research being done in Zambia will give quite a lot of that, and also just to encourage Save the Children to, and I know it's difficult in an NGO environment, but just to keep recording what you're doing, the activities you are doing. Not necessarily, it would be nice if there was academic research, but I think there's also real value in practitioners recording what they're doing and sharing that, because that's how other practitioners learn. So yeah, thank you very much.
Thank you. Over to you, Mwelwa.
Yeah, thanks everybody. Thanks to the other presenters, and thanks for everybody that was listening. I think for me, the presentations and the discussion has really emphasized why it's so important to engage with the different subgroups, because they have very specific needs, which are very different. And so something that Glynis brought up about they're not, it's not one homogeneous group. And I think that's really important to remember and to apply, even as we form interventions and try and work on evidence, which can have an impact. I think we have to keep that in mind. And so for me, co-design involving the different subgroups is really important. And I think that's what will lead us to sustainable impact. And I think that's a really key thing to remember.
Yeah. Thank you so much, Mwelwa. Margaret?
Thank you very much to you. Thank you to Mwelwa. Thank you to Glynis. I've learned a lot from your presentations, and it's really interesting that these different pieces of work actually speak to each other, and it's the same experiences in the different countries. And so it's three things from my side. One, young migrant persons are not victims. And I'm quoting from what Glynis said. They are resilient, they can contribute meaningfully to communities and economies. And therefore, we need to ensure that they participate and they indicate what wellness means for them. We need to find out from them continuously, and those engagements remain critical. Secondly, we need to address the issue of documentation. As long as they are invisible, they live in fear, they live in hiding, and we will not find answers. And so it's important that we allow their identity and they do not live in fear. And lastly, we need to collaborate. I think this has been indicated by the previous speakers, and we need to look at what does collaboration mean for us, and how do we then address the issue of data around migrant young persons? How do we then implement and address issues of policies when it comes to access to wellness for young persons on the move? Thank you.
Thank you so much, Margaret. And thank you to everybody for, being here today and part of this very important discussion. I think the key take home for me also is really that mobility should never be a barrier to dignity, health, and rights. I think, as people move, we need to find ways in actually working together and ensuring access, because if they don't get this access, it actually affects the bigger communities in which they may live in. And I think really the way forward is that we need to remember that the issues that we're thinking about, should be co-designed, and they should be youth-centered, right-based, and grounded on lived experiences of these young people, just as the speakers have spoken to today. And lastly, I think we should continue collaborating, as Margaret rightfully says it, to ensure that no young person is left behind, no matter where they come from or where they are going. So really a special thanks to everybody, especially our speakers, for, setting aside time to be here and sharing with us the different experiences and learnings that they've had in the different contexts in which they are working in. So yes, let's stay connected and let's keep pushing for systems that serve all young people, all modern young people. So thank you so much, everybody, for joining today. And I hope everybody's going to have a great day. Thank you.
Thank you, Langa. Good day.
Thank you.
Thank you, Langa. Thanks, everyone.
Thanks, everyone.